my name is Sarah McCain and I'm a DUville nursing student. And I'm going to verify the patient's name and date of birth. Today we're going to be inserting an NG tube. Have you had any trauma to the nose, or are you on any anticoagulants? Is there any risk of bleeding? The patient states no. And do you have any allergies that I would need to know about? Patient has no allergies. So I am going to begin setting up for my procedure. I'm going to wash my hands. And I'm going to don gloves. Alright, the patient has not had any surgery or trauma to the nose, and he is not on any blood thinners, and there is a low risk for bleeding. I am going to assess the patient's nares, make sure they are patent. Good. And I'm going to assess the patient's gag reflex by touching the uvula. Good. And then I'm going to listen to the patient's bowel sounds. One, two, three, four. All right. And I would sit the patient up into the high Fowler's position, and I am going to measure my NG tube. So we would measure it from the nose to the ear, then from the ear to the xiphoid process, and then I would add 10 centimeters, so 55 to 65, and I would mark it right here. That is how far I'm going to advance it. So now I am going to get ready to insert the NG tube. I'm going to bend this down, and I would lubricate the first 3 to 4 centimeters. Okay. And I'm going to begin advancing it. So we're going to insert it. And I would offer the patient water to sip water and advance it while he is swallowing. And keep advancing it until I reach the mark on my NG tube. All right. So I have advanced it to the mark on my NG tube, and I'm going to check the mouth to make sure that it is not coiling in the oral cavity, and it is not. So once I have advanced it, I would get my tape and secure it to the patient's nose. All right, so I've secured it to the patient's nose, and then I would clip it to the patient's gown. And before I could use the NG tube, I would verify placement. There are 4 ways to verify placement. You would get a chest x-ray, which is the gold standard. You could aspirate the contents of pH, which I am going to do. So I'm going to hook this up to the end of the NG tube. And I would aspirate the stomach contents. I've aspirated it, and I would test it on my pH strips, and if the contents were within the pH range of the stomach, that would be a way to verify placement, which is about 4.5 to 5.5. I could also do an audible air bolus, which I would use that. I would inject air while listening over the stomach, inject the air, and I would hear the air. Audible bolus. Or a 4th way to check for correct placement would be capnography, which would be the CO2 placement to ensure that it's not in the lungs. After I am finished, I would document the procedure, how the patient tolerated it, and the confirmation of placement before I began using it. And that is the end of NG tube insertion. I would clean up my slides.